issues in healthcare, and frankly, for me, the political issues, I'm fairly agnostic on those. I don't much care whether it's one payer or 1,000 payer, or whether the local insurance companies are involved or are cut out. I think those are political trade-offs, and in our country, being hard-nosed about those generally doesn't get you very far.
I just turned it off.
Okay.
And I have my own preferences, but they're just my personal ones. I don't have any particular theory that makes them better than anybody else's. What for me is critical is that there be a healthcare program. I think that's a moral issue. The lack of a healthcare system in our nation that serves the entire population is a moral failure equal to racial segregation. It is not tolerable in a nation of our income level and resources to allow 1/3 of our children to go without proper care. One of the real problems with lack of insurance is not that somebody doesn't get served. A lot of people who don't have insurance squeak through the system by going to emergency rooms and finessing government things, but a decent healthcare system offers preventive care, and preventative care for especially children, pregnant mothers, and certain classes of elderly people make a huge difference in quality of life and health. And to not have those services available for somewhere between 20 and 40% of our people just is to me, as I say, it's offensive to me as racial segregation. I think it's just unforgivable that nations with far fewer resources than ours can take care of their citizens, and we can't. In fact, Cuba is a fine example. Cuba is the example used in Sicko, the movie. Cuba is a fine example of a nation with practically no resources that takes better care of its infants than we do. And if that doesn't strike you as being completely wrong in some fundamental moral way, then I don't understand how you can call anything moral. It just strikes me as unbelievably offensive that we're so greedy and selfish that we think money is better in your pocket than in national health care. The strength of the nation, the strength of the nation's economy are partly the problem here. We were almost too wealthy to worry about people. Those days, as the gasoline shortage shows, are coming to a halt pretty quickly. And I think it's now time for us to pay far more attention to the folks who are not being lifted up by the economy. There is a clear underclass in the economy that's not being served. And to allow the underclass to go without any health insurance, any kind of decent preventative care, is morally intolerable. And it's intolerable because of the great damage it does, the clear scientific evidence of the great damage it does to individuals' health and to their well-being, to their mental health as well, to their spiritual health. The failure to consider these as a part of our national identity, to in effect cut 1/3 of our children out of our national identity, and to not care for them, to show no compassion for them at all, is just unbelievable. I can't believe, I remember, frankly, I lived in Canada in the 1960s and early 70s, and I had a Canadian healthcare system, and I came back to America to serve my first church after finishing my graduate degree in Canada. And I looked at the cost of health insurance and I said, this is just unbelievable. How can Canada, at that time, a minuscule nation compared to the United States, can take care of 100% of its citizens, and even the people who are visiting the country on a student visa, not a landed immigrant, not a person planning to become a citizen eventually, just a person there going to school, had the same health care coverage as everyone else in the country. And if I got strep throat, I went to the doctor, she gave me a shot, gave me some pills, right then, just right then, boom, you're done. Cost me nothing. I paid taxes, but as a student, the truth is I didn't pay any taxes. I was getting all of this health care free on the backs of Canadians. And it says something about how you see your nation, what you think of your nation's values, how you identify yourself as a Canadian to do that. And it says equally that how we see ourselves as Americans and don't do that says something about our nation and what we think of ourselves as a people. We don't think of ourselves as a people. We think of ourselves as those who have and those who don't have, and to hell with those who don't have. That's a terrible, terrible thing to say about this nation in its founding and its history and the values that were the American identity up until some point in the late 1800s. It should embarrass us beyond all measure. But it should also make us angry that we've allowed things to get to such a ridiculous and embarrassing state. And if we don't pull together somehow to address this issue, it costs $1,000 for the ambulance to come and pick you up and carry you to the hospital. $1,000 for the ambulance to come and pick you up and carry you to the hospital. And if you don't have insurance, they don't care. They take the $1,000 one way or another. You can finesse some of that depending on your contacts with social services, but basically you're out $1,000 if you need to get from your house to the hospital in emergency and you can't drive, and you don't have anyone there who can drive you. My insurance paid $800 of that. When I had to take an ambulance, it cost me $200. We went approximately 10 blocks. Cost me $200, and my insurance company some percentage of $800. I don't think they paid the full amount. But the bill was exactly $1,000. They did administer a shot, otherwise it would have been $950-something. We have to understand that our health care problem in this country is not just its availability, but its cost. And John Walker's presentation really covers a lot of that, which I won't do. It's a brilliant presentation. I'm sure we'll have it back in the fall. We had scheduled him, he and I were going to do a program together, but he went to Costa Rica for 2 weeks donating his services